Walawani, welcome. My name's Ian Campbell from Palliative Care Australia on the lands of the Ngunnawal and Ngambri people in Canberra. Welcome to Thursdays at 3, our regular series of conversations with people living and working at the end of life. A great person for you to meet again today, Juliane Samara, a specialist palliative care nurse practitioner. Juliane works for the Canberra Health Service as part of the PEACE team, aka the Community Specialist Palliative Aged Care Service, run out of Clare Holland House. In 2019, Juliane won the National Palliative Care Emerging Leader Award. Also in 2019, she picked up the ACT Nursing and Midwifery Excellence in Clinical Practice Award. She's written for The Guardian Australia, and on Twitter, you'll know her as the Unravelled Nurse. And earlier this year, you might recognise her face. She was one of the faces of our National Palliative Care Week campaign. Most importantly, in her 20-year career, Juliane reckons she's looked after thousands of dying people in aged care. I'm so looking forward to our conversation this afternoon, Juliane. Thanks so much for your time.
Thanks, Ian. Thanks for having me here.
Tell me, Juliane, what do you think, what do you feel when you hear that, looked after thousands of dying people in aged care? What do you feel when you hear that about your career?
Tired. I'm kind of proud of that. Aged
Absolutely.
care is not a place where a lot of people choose to work, and it's actually a great place to work. So if I've helped to increase access to specialist palliative care and help people to die well in aged care facilities, then I'm going to say I'm proud of it.
Yeah, rightly so. That's good to hear. Why don't people want to work in aged care, Juliane? Or why do you choose to work in aged care? What do you get out of this?
I'll start with why I choose it, I guess. I really love older people. I grew up in a big family. My grandmother on my mother's side was one of 13, and she looked after her brothers and sisters as they got older and after her own mother. So I grew up going to stay with my nan, with her mother who'd had a stroke, in the spare bedroom in a princess chair, and I helped care for great uncles who'd had strokes and visited them in residential aged care. So I guess I always had that affinity for spending time with older people and really loved it. What do I get out of it? We are so privileged to have an older generation of people who've experienced amazing things in their life in a world that has changed so dramatically in the last 100 years. And to go and sit with people and hear their stories and meet their families and spend time unpacking what they've learned throughout their lives, and then being able to take away some little snippets of that and thinking that that's great advice or things not to do, is actually really rewarding.
Yeah.
So that's why I choose to do it.
Getting people to work in aged care is a real challenge. Hopefully it's less of a challenge in the future as the government's reforms roll out. Do you understand those challenges? Do you understand why people are reluctant to go there?
I do. I think it's a challenging environment, to walk into a facility that might have 100+ older people with such a huge variety of complex needs. So people are, living longer, they're older and sicker than they've ever been before. I think residential aged care facilities are subacute hospitals in all but name, in spite of the glossy brochures that says they're a home-like environment. It must be incredibly difficult for people to have come from living independently in their own homes to suddenly being in this big group situation. That can be challenging, that can present as behavioural symptoms, where staff are running after their tails trying to meet the needs of people and manage things that are cropping up. It can be frustrating to walk into an aged care facility and not find the right person to speak to, not be able to get a good clinical handover. The workload is high, resources are low, people are tired.
Mm-hmm. Are things changing? You wrote a great article for The Guardian Australia just before the last election. And of course, the government changed in May of 2022. But the article that you wrote for The Guardian was published in April of 2022. And it really put a rocket up where things were at. You were really banging the table for reforms in aged care. Have things starting to change? You're seeing a difference now, sort of 12 months or more down the track?
Oh, look, I think so. I'm seeing some positive changes. I think it's really difficult for a government to come in after, many years of neglect and to make significant changes that have an impact in a short period of time. So I think it's too soon to say. I think there have been some reforms coming out of the Royal Commission that have increased workload for registered nurses in aged care and taken them off the floor to do more paperwork, which is a really unfortunate result. But, having nurses in aged care 24/7 around the clock care is absolutely the thing that I was banging on about in sheer frustration. And so that's been implemented from July, and in most facilities that's happening. There are a few that, have some challenging difficulties recruiting, but I think that will happen. I think the changes to the funding model with the ANAC funding model are starting to see some benefits from a palliative care perspective, with people coming into aged care with the appropriate, so never enough, but an appropriate assessment and appropriate funding to match that assessment. I'm on the aged care task force looking at the funding and sustainability of aged care into the future, and we met for the first time last month. And I came away from that feeling hopeful that we will have some changes, systemic changes that will improve things in the future.
Oh, look, you've just given me goosebumps thinking that people like you are on the aged care task force. That gives me hope, and I think gives our community hope that people like you are influencing that change. Of course, RNs 24/7 was one of the recommendations that came out of the Aged Care Royal Commission, and there are about a dozen recommendations that talked about palliative care and aged care needing to be better connected, that palliative care needed to be an embedded practice within aged care. And I think for most people, they were really surprised to hear that it wasn't already. What does palliative care look like in aged care?
I think palliative care is core business in aged care. We talk about people needing palliative care when they've got a life-limiting illness. What could be more life-limiting than the clock ticking down to the end of your life with the
aging
expected
process,
lifespan? Yeah. So I think I think everybody who works in aged care needs to have a good understanding of palliative care. They need to understand that people are going to die. I meet carers and registered nurses who come in fresh and new into aged care and are absolutely shell-shocked the first time someone deteriorates and we say this person is dying. So we really need to improve, I think, our undergraduate programs and our mandatory training for care staff so that they realise that this is the environment they're walking into and that they are going to have to face this. And for many, that's not just a confronting thing personally because they're young and they don't see dying in the community, but often it's a cultural thing because they're coming from other countries where they don't talk about death and dying out loud, where they don't have palliative care services, where it's not a named part of somebody's clinical care. So I think we've still got a lot of barriers to overcome with the workforce that is currently in aged care in the future and into the future.
Juliane, when we talk about you being with thousands of dying people in aged care during the course of your career, all those people have got families and loved ones as well. That's perhaps an extra dimension to palliative care. You're looking after the patient, the person, but equally you're looking after the ripples that come from that person, the loved ones as well. How do you go about, I guess, juggling that care, which me sitting here, it feels like there's perhaps two different approaches. You've got an approach to the patient and an approach to the family and loved ones. Tell us about that role you play.
That's probably one of the most challenging and interesting aspects of the job, because not all families are the nice, neat little package that you
No.
see on TV.
Yeah.
And, there's often a lot of conflict. There are a lot of dysfunctional families, and unpacking that and understanding how people fit with the person you're looking after, and the impact that those relationships can have on the way someone's going to die, is really important. It's kind of difficult. Our aged care palliative care service is not funded for allied health and the psychosocial supports that our inpatient unit is. So I am really blessed to work with some fantastic pastoral carers and social workers who, when I go to them, they know it's because things are really desperate and I really need their help. And they're very happy to give advice, and they will go and see somebody if I need them to. It would be great if the funding for specialist palliative care services in the community matched the model for inpatient units, so that we had that broader team that could look after all of those psychosocial needs that come with complexity in families. It's great to build relationships with families, though, and to get to know them. Often the first thing when I walk into someone's room is, to sit beside the bed and look at the photos around the room and ask them to tell me about their family. And then if family are there and they contribute to that conversation, it's a really nice way to build a relationship. And I still have families that 4, 5, 6 years down the track send me a text message or an email on the anniversary of their loved one's death, and just remembering and thanking you for the work that you did and keeping in touch, which is really lovely.
Yeah.
It can be very emotionally draining, though, having all of those connections and sometimes competing priorities when the family's expectations and wishes don't match that of the person you're looking after.
What do you do with all that for yourself, for your partner, your kids and your grandkids? What do you do with all that emotion that just layer upon layer builds up over time? How do you deal with that?
Sometimes in better ways than others.
Yeah.
It's really hard to go home at the end of the day where you've dealt with all of that and just fall into your own family life. So often I have a period of downtime where I need to be quiet and need to reflect. And the fact that I've got a 20-minute drive home is usually enough, unless it's been a really bad day. I like to get away to the coast as often as I can on weekends, because that just grounds me and refreshes me. And as I go over the mountain to the south coast, all of that stress kind of drops away. And when I get there, I'm a little bit disconnected from life in Canberra, which is kind of nice. But I write. And sometimes it's angry writing, sometimes it's sad writing, sometimes it's just reflective writing. But for me, that is probably my most effective decompression strategy.
Mm-hmm. Let's talk a bit more about that writing. What do you do with it? I imagine sometimes it's just for you, but other times, clearly, you've written for The Guardian Australian. You publish to Twitter. Other times when you write, it's for other people as well. Tell us about that.
It can be tricky to divide that up. The writing for me often is written for those audiences but never gets published. So, I might have had a very tricky week, or have a couple of scenarios in my mind that are just on repeat and I can't let it go. And for me, being able to write it down and put it into some sense of order and reflect on it as I'm writing, sometimes that's enough, and I never actually click that publish button. Other times it's a process of writing, reading, editing, writing, reading, editing over and over and over, and that it can be months. And then sometimes I do the angry Twitter thing where I just get it out and hit send and think, oh, maybe I actually shouldn't have done that. And during the election campaign, that was probably the most writing I did, was the angry tweeting writing, which I regretted sometimes, and other times it was powerful. So yeah.
Is that a reason why you write, to advocate for your patients, to advocate for your colleagues? There is that sort of self-care that seems to be a part of it, but is advocacy part of this as well?
I think it is now. I'm not sure I ever really intended that. I think when I started writing, it was for me, and just because I like to write. And then when I realized that people were reading what I wrote, I actually thought, hey, maybe this is a tool that I can use. Maybe this is actually powerful. And so sometimes when I'm writing, I'm really conscious of, I want to get a message across, and that message might be about my colleagues. It might be raising awareness about palliative care. It might be raising issues that are political. And when I write that and I hit that publish button, sometimes I hope it will take off, and sometimes it does, and sometimes it doesn't. And there it doesn't seem to be a rhyme or a reason to what grabs people's attention. But I think it's a tool that I try to use wherever I can, just to raise awareness about the work I do and the people I meet, and the role of palliative care and the role of nurses.
In thinking about what works and what doesn't work, and the history you've had on social media and with the media, have you been able to work out what are some of the secret ingredients to making a story work, or to getting a response or a reaction?
Not really. If I'm really honest, I think I don't really want to analyze it too much, because if I try and analyze it, I'm worried I'll start writing to a formula.
Yes,
And
good point.
what I've learned is the formula doesn't always work anyway.
It's your authenticity that
Yeah.
you would lose if you start thinking about it too much.
I think so. And I think actually the things that I've written that have been most successful have been the things that have come from the heart, that have told a story that resonates with people because they can identify with it. And they're the ones that I probably didn't sit there and think, who's going to read this? What am I trying to say? It was just get it out and hope for the best. So I don't think I've worked it out. There's a lot of learning to do.
What about things like confidentiality, social media policies with the company you're working for? How do you go navigating that stuff?
That's probably the trickiest part of it all. And probably the things that I never hit the publish button on are the ones where I think, oh, maybe there's something in here that would identify someone. So, there are the social media policies for my company. There's confidentiality agreements with the facilities I work with.
Yep.
There's that respect for privacy and dignity that I have for my patients and their families. There's my responsibilities under the APRA Code of Conduct and my standards for practice. And if you put all of that together like that, you kind of think, well, maybe I shouldn't write at all.
Yes.
But when you work it through, and I guess what I try and do is, if I'm writing patient stories, it's not necessarily one patient. So there might be bits and pieces from 3 or 4 different patients who've had some similar theme, and I pull those together to be a patient or a resident. And that's how I get around privacy and confidentiality a lot of the time. It's an amalgamation of everything I do, not any one specific case, even though sometimes it might sound like that when you read it.
Yeah.
But it's really tricky. It's the thing that I have lost sleep over occasionally when I've hit the publish button before thinking about it. There have been things that I have deleted after, because I've thought, oh, maybe that was something that could identify. Canberra in particular is a really small place.
Yeah.
Everyone knows everyone. I am 5th generation born and bred. My grandchildren are 7th generation born and bred. So we know everyone in Canberra. There's some family link everywhere, and I need to be really careful about that.
How do you cope with the attention that comes from some of this stuff? As you say, some of it takes off and goes big. How do you cope with that attention?
I hide under a rock. I'm not good at that bit. I think particularly when it's negative attention, the best way to manage that often is to ignore it. So if, we know that social media can be a pretty nasty place sometimes.
Yeah.
And so, I'm probably not the only one that's had some nasty comments or some things directed at me personally. And if I read those and thought about them and dwelt on them, that would stop me writing. So sometimes just stopping reading comments is a good strategy. The positive stuff surprises me. When The Guardian approached me to write for them and sent me a contract and said they were happy to pay me to write for them, I went, but this is me. I didn't actually finish college. I didn't go to college, I came to nursing really late in life. I really struggled to do a degree and then a master's. And so it's that imposter syndrome that, is this really me? Like, what is it here? So I'm not great. And I'm a real introvert, actually. I don't like attention. I can stand up and present. I can stand up and talk publicly. I've taught myself to do that, but it's not my comfort zone by any means. And so I'm the quiet one, usually in the corner at parties, not the one that's out there laughing and introducing myself to strangers.
We'll post links in the show notes to the article that we've been talking about with The Guardian, and indeed we'll link through to your Twitter account as well. Juliane, we're keen for people at the Oceanic Palliative Care Conference coming up in Sydney this September to use social media to sort of amplify the learnings, amplify the experience, and do some of that advocacy work that you pointed to before. Any tips or tricks for people coming to OPCC and perhaps wanting to share the experience on their own socials?
Sure, acknowledging that I'm not an expert in this. So anything I'm going to say comes from just what I do and how I approach it. But I actually really love tweeting at conferences and even posting on LinkedIn from conferences. I think it's a really great way of spreading the message and helping to educate other people. One of the things I like to do if I have time is to look at who's presenting or speaking, particularly keynote speakers, and follow them way ahead of the conference. So I get a feel for where they come from. And I look at their followers, particularly on Twitter. Are we allowed to call it Twitter now? I think it's X. So maybe I'll be Xing all over the conference. But I look at their followers because often that's a really great way to build your network and make connections. And so I follow the followers of the people that I really like. And that's really helpful because then you get some power in tweeting and retweeting. Using hashtags is something that I always used to forget to do, but actually that's really powerful as well because that creates a network of people. What else do I do? I reply. I don't like to just tweet a slide, from a conference. I like to actually provide a little bit of insight or what was I thinking or what was the main message here in an attempt to start some sort of conversation. And so then when people respond, making that a conversation and replying to replies is actually really helpful. And sometimes is the reply is, it'd be great to meet up at morning tea and talk about this. I'll be at the whatever stand. So they're my tips for new players that may or may not work.
Solid gold. Really looking forward to spending some time with you at OPCC this September in Sydney. You'll be there. Registrations are open right now. And if I could just give everyone a bit of a tip, prices are going to go up on the 18th of August. So if you haven't registered yet, get in now before the price rise. Juliane, just before you go, you mentioned that feeling of going over the mountain, getting down the coast. I think that's something that a lot of people in Canberra and indeed communities right around Australia can relate to. Where's your favourite place on the coast? Not to give away a secret beach or spoil a special spot for you. Where do you like to go when you go down the coast?
We're so lucky. At the start of the pandemic, we actually bought a house in Turos because my parents are on the south coast and they're fit and healthy at the moment, but I knew that in the future maybe I'd be needing to spend more time down there. So I wanted to have my own base. So I have a really beautiful house that looks out to the ocean with a gorgeous cottage garden, and it's just like this little island in the middle of my busy life, and that's my favourite place to go.
Cheiros is such a magic place. My heart sings, Juliane, because I think Canberra wastes their time at Bateman's Bay. The best part of the coast is Narooma South, I reckon.
Yeah. The whole coastline is beautiful, but when we were looking, we looked from Bateman's Bay to Narooma in terms of how many hours does it take to get there on a Friday night after a terrible week. And the busyness of Bateman's Bay and all the way down to Maruya was just... that's not what I was looking for. I was looking for an escape and some tranquility. And Cheiros is off the highway. It's perfect because it's got a couple of different beaches. It's got a little shopping centre. It's got a really great community. They're all old. So I'm going down there to start a private practice when I retire because Cheiros is called God's waiting room to anyone who knows the South Coast. So I reckon it's perfect for a retired palliative aged care nurse practitioner.
Sounds it. And look, just to retract my comments about Bateman's Bay, we'll perhaps create some social media rage with my comments about Bateman's Bay. It's a great place. It's a great place. Juliane, thank you so much for your time today. We'll see you at OPCC. Thank you for sharing your work and your wisdom and what you do in the Canberra community and influencing change and reform wider afield. Thank you for being here today and for what you do.
Thanks so much, Ian.
And thank you to you for tuning in to Thursdays at 3, whether that's via PCA socials or Spotify, and engaging in matters of life and death. To register for the Oceanic Palliative Care Conference, head to the OPCC website. The full program is there, so you can plan out your 3 days. And as I mentioned before, beat the August 18 price rise and register now. You'll find advice, tools and support with matters of life and death on the Palliative Care Australia website, where you can also make a donation to support our work. Thanks for tuning in. See you next Thursday.